Hi, welcome back. This is a UFLTV interview with Dr. Kim Openshaw. Dr. Openshaw, if you want to introduce yourself a little bit. I know you introduced yourself in the last one. So,
Sure. I
yeah.
am Kim Openshaw. I reside up in Logan, Utah. I've been here since 1981, where I developed the marriage and family therapy program and worked with the Department of Psychiatry at the hospital. Um, so I have been involved with the courts up here. I was involved with the courts in Wisconsin when I was back in Wisconsin prior to coming here. As an expert witness, and so been in the position of an expert witness. I have done custody evaluations. It's been a few years that I've done them, but I do have some insights that I hope are helpful. And we began last time talking about parental alienation, and today we're going to focus more on parental estrangement. However,
Wonderful.
here are some of the kinds of questions that might come up and things that I've designed this around. One is, how does parental alienation really differ from parental estrangement? These words are thrown out and intermingled as if they're one and the same, when in reality, they're two very different terms. And
Yeah.
sometimes the people you're working with, families, they don't quite understand the terms and need a little bit of help. Ours will be a little bit more scientific as we go and clinical. Uh, you can do it more in a psychoeducational way that would be appropriate to families that you work with. A second question might come up is, what is or are the mechanisms by which parental estrangement manifests? Which suggests that there are more than one types of parental estrangement. And we'll talk at how each of those occur. Third, does clinical intervention for parental alienation differ from that? What might be used to address parental estrangement? We'll look a little bit of that. We're going to only look briefly into the clinical interventions, but at least you'll have some insight into it. We did talk about parental alienation, the clinical interventions last time. Let's move on here a little bit. Let's start and go back, and I apologize if this is a reiteration of some of what you've had, but let's look at this. And
It's
you
always good
notice
to go
I've
back
kind
over a term. Yeah. In case people have forgotten what they mean. So, yeah.
yeah, and I've kind of highlighted some words that might help bring out the nature of this parental alienation. It's a conscious process. It isn't something that's subconscious or unconscious. They don't know what they're doing. They may not know it by the term, but they certainly know that their behavior is not appropriate. Now, they may delude themselves a little bit in terms of saying, oh, no, I'm really acting on the best interest of the child. But honestly, if they're honest with themselves, they'll see that's not the case. It's an active process. It's not something that just happens. It's actively through passive aggressive or aggressive techniques used by one parent against another parent in their interaction. Interestingly, simultaneously, while those two parents are engaged in some kind of interaction, and one of them tends to be more oriented towards the alienation process, simultaneously that individual is employing covert manipulation techniques that affect the child in a psycho-emotional way and in a physical nature. And what it does is it exploits and damages the attachment the child would have with the other parent. And so if you look at that, it's in a triangle, and this is why we call it triangulation.
Yeah, we spoke about that a little bit in the last interview.
We
Uh,
did.
yeah.
And Braxton, if it's left unchecked, that's a problem. It becomes a very intense mode of exploitation, and it will corrupt that attachment process of the child to the other parent. So that's what the definition of parental alienation is. Kind of look at it here for a minute, a few of the factors that are associated with it. One, the parent who typically is engaged in parental alienation, um, their actions are grounded in secondary emotions. And what I mean by that is we have primary emotions, but we don't like feeling them. Like if we were in an interaction and I hurt your feelings, you probably wouldn't come back and say, Kim, you hurt my feelings. You'd become angry. And that's a secondary emotion. And so these secondary emotions act as a protective and defensive mechanism for our primary emotions when they get hurt. And of course, we talked about one of the key factors being triangulation. And the child gets caught in this paradoxical grip. And what I mean by that is it's a damned if you do and a damned if you don't. So the child can say, hey, I want to go with my dad. And the mom might say, oh, okay.
Yeah, okay. You're just doing this to hurt me. And then the child gets dragged into it.
So
Terrible.
I was saying that as intense as love pulls people together, the other thing that has as much power and maybe more is hatred. And that's very intense. That pulls them together. So this
Yeah,
intense animosity is governs this triangulation.
a lot of people don't believe that love and hate are actually that far apart.
Well, and I have to say it may not be that far apart, just two different polar dimensions of that intensity. And there is an extreme and unrelenting desire to violate the rights of the other parent, often by making indiscriminating accusations, things that they really can't back up, but and they cause them to be greater than they really are. Okay,
Okay.
so some of the issues of parental alienation. Any thoughts, Eric or Braxton?
Well, so it seems like these people are they're not doing this subconsciously, and they don't really know how to articulate the way that they're feeling. So they will then take these actions where they essentially just throw spaghetti at the wall, see what sticks. They can't back these kind of accusations up, and they'll just kind of do whatever um, they they want. They'll pull the kid in. They'll make them a part of the argument when they won't do it, and kind of get that triangulation going, so that they can just hurt them more.
Yeah, they do that, and unfortunately, these people get caught up in it, and there is some secondary gain. So if this other parent begins to feel hurt, then the alienating parent is reinforced and continues in that direction.
Yeah. I mean, if your goal is to alienate this other parent, and some things are working, you're going to get like a sense of accomplishment from that, even if
Yes.
you're not trying to do it.
Yeah, that's true. Okay, so let's look at estrangement. Again, it's a conscious process. I wish I could say that these people enter into these things not knowing what they're doing, and under the impression that the devil made me do it. But honestly, they're aware that what they're doing. Again, may not be able to put a label to it, but certainly involved. Now, this definition is primarily to what I title parental induced estrangement,
Okay.
because you'll see that there are different types of estrangement. And so a person who is actually engaging in bringing about this estrangement, it's a conscious process, and it usually begins early in time and continues over a period of time with the person who's estranging just kind of backing out of the physical, intellectual. There's no condemnation against the other parent saying, oh, you're a lousy parent. That's why I'm getting out. The other parent really is probably doing an okay job. It's just this one is starting to pull away. It's an active process, and it uses two very important cognitive distortions. One of them known as rationalization, and the other known as justification. Now, when I was taught about rationalization, the person who taught me says, well, it is the rational lies that we tell ourselves to engage in a certain behavior or a certain way.
So it would be, so an example of that would be like, well, I wasn't told about child's activity, so it would kind of be fair to not tell them about child's activity that I know about. Or it'd be, well, this person hurt me, so I mean, hurting them must be okay.
So yeah, it's in the rationalization, the one you used in terms, oh, well, you didn't tell me about this activity, and therefore, if that is an ongoing behavior, then you can say that person is rationalizing their lack of associating with the child. Maybe it's going to their first day of school where they meet with the teachers and things like that. So, okay, so that's kind of what's going on. But if you look at this, like we did with alienation, here are some of the things to understand about estrangement. First of all, it occurs in three different ways. One way is what I call parental induced alienation. In other words, it's through the process of an alienating parent who sets up a triangulation that causes such emotional, psychological difficulty for the other parent that the parent just gives up and walks out.
So this is kind of like every time you try to talk to them about something related to your child, they just start spamming your phone with text messages, or they start screaming at you over the phone, and it's like, well, as in the scenario, as the other parent, it's just better to not engage rather than take all of that, and then that kind of becomes the alienation that the other parent is doing by pushing them away by doing these kinds of things.
Yeah, you go to pick up the child and they're not there for visitation. You are told a date that this school is meeting with the children. You go and the school's closed because that's not the date. So there are these tactics that are being used, and pretty soon the other parent becomes very frustrated. They don't know how to make contact. Phone is being limited or not allowed to answer. I mean, it goes on. Second is child induced. Now, what I mean by that is there are times when children begin to estrange themselves. Most likely this happens after the tween years, when there's some kind of combative episode that occurs between the parent and the child, especially if a divorce has already occurred and that child is, in the other family, and the father says, no, when you're in my home, these are the rules. And the child says, oh, no, I'm not going to do that. And it creates a conflict. And pretty soon the child says, I don't want anything to do with you. And so the child begins to estrange. Sometimes it's because of something the parent does. They hurt the child in some particular way. Sexual abuse, for instance, could be something where the child, and it may not have already been disclosed, and the child may back off and not want to be around that parent, show considerable fear in that. So there's child-induced as well. And we'll talk a little bit more about that in a minute. And then there's parental-induced estrangement. And that's where a parent is the one backing off. And we've talked to some of that, but there's a number. So I get remarried. My child comes over. My wife doesn't like the child, doesn't want that child's competition. especially if we were the only two, there are no other children, then there's competition. She doesn't like the competition. She becomes jealous. And actually, she begins to step into an alienation kind of process, kind of forcing then her will upon the. That's not the only way it happens. Sometimes there's what I call narcissistic egocentricity. Egocentricity is a part of narcissism, but I say it this way because it highlights the egocentricity, the fact that the person inside is so much in desire of their own wants. And I'm going to say wants, and not necessarily needs, but wants, that a child in their life will undermine them doing what they want. And so they just stop seeing the child or make excuses for not picking the child up.
Yeah, so I think people see this very often when hey, where are you? You're supposed to come pick up the kid, and they go, oh, I'm actually out of town this weekend, or insert any other excuse. So something came up, and that happens week after week after week after week.
Yes.
So
yeah. And in this kind of a process, oftentimes they take this martyr, oh, you didn't tell me, or oh, I thought it was another day, oh, kind of woe me attitude.
Yeah, what do you mean my custody weekend's this weekend? It was supposed to be next weekend. It's like, dude, that's not how it's worked at all. That's our custody schedule has been set since our divorce. It's been the same every single time. I don't know why you would think that.
And if you're not going to change the date for me because I need to change it and want to change it, then fine. I just won't come and get the child.
Yeah, and then that guy blames them. It's like, well, you're keeping me from seeing my child because you won't be accommodating. It's like,
yeah, that's that martyr image.
Yeah.
Oh,
yeah.
Woe me, you won't help me out. But the problem is they're always changing things. They're never satisfied. So the goal is for them is to sustain the delusion that abandonment is the best interest of the child and offers both the child and themselves the best avenue for personal experiential fulfillment.
Yeah.
So, okay, so just kind of a summation there. Let's look then at these, and I'm going to try to draw this out a little bit so you can see them. So we got parental alienation. We talked about it. That is feeding into the cause of the parental estrangement. So here are a couple examples. Some I'll repeat myself, some I apologize. But so the alienating parent interferes with, or more specifically, they prevent the other parent from interacting with the child. And you brought up some of these, Braxton, limiting the phone calls, or the child's on the phone and the other parent's kind of huddling right over the top of them, and wanting to hear. I'll put that phone on speaker, and so I can hear. And if something comes up that they don't like, then either they'll blurt it out on the speaker, or when the child's done, the child gets punished for it, or some kind of lie is put in. Father's home and was coming to visit the son, well, the father. And as they were visiting, the father said, oh, let's go to grandpa and he's invited us over for dinner. And they said, no, we can't go and visit grandpa, because mom told us if we did, he would poison us. So that's kind of those types of things in there.
Yeah.
And then there is the tactic of just undermining the integrity, the moral character, the intent, the true interest, the motivation of the other party. They're just hammering them, just tearing them down in front of the children. And it isn't necessarily with that parent there, although I've seen it happen. Oftentimes the parent leaves and then they, oh, well, that's just like your dad. That's just like your mom. What do you expect to happen? So,
Yeah.
so these are a couple of things you see. And I know there's more than this, but these are a couple of the things that were commonly seen by myself. Okay, so child-induced estrangement. So we talked some about that, where the child has been persuaded, from an early age. And oftentimes these are in subtle, covert ways that the relationship with your father, mother is not good, and you would be better off with me. And if the child chooses not to go or puts up a fuss to go, and then the visiting parent says, fine, I'm not going to take the child like this. I don't want her to think, or him to think, that I'm a bad person, so I won't. And then the father and mother leaves, and the other parent says, see, your father, your mother didn't want you anyway. Age and creeps up across time until such time as the child just refuses to go. The other parent's still paying child support. In fact, I know a case right now where the parent is still paying tremendous child support and alimony, and yet has never been able to have the children visit them
That's
because
terrible.
the mother just refuses to do that. And she makes up excuses. And now the children are older. They're, 14, 15, 16 years old. When the dad calls and say, hey, I'd like to come down and pick you up, is see you. And that's what that happens there. And that's an unfortunate thing. Another way this estrangement can happen is, like I said, there's an actual event that occurs that creates a rift between the child and the parent that seems unreconcilable to the child. And so the child begins backing off. And no one really intercedes to resolve that difference, when in reality it may not be an actual situation, it may be a perceived situation. So two ways that I have seen often in estrangement. Any thoughts or
Yeah, it seems like this is the sorry, I cut out for a moment. It seems like this is the kind of stuff that if you have a really unfavorable um, custody arrangement, like you pay a lot of alimony, a lot of child support, and you don't get to see your kids, seems like it would feel really terrible if your kid said, well, I'm only here with you for the weekend. So, I mean, if you don't do this, I'll just not come on the next weekend, trying to like leverage your custody kind of deal against the parent. It's like, well, I don't want to be a bad dad and I want to see my kids. But on the other hand, what am I supposed to do when they're trying to leverage the custody deal against me?
Yeah, yeah, I know. So second way is child induced. Now
Yeah.
let's look at the third way,
Okay.
and that's the parent induced. In other words, the parent does not belittle the other parent or put them down, doesn't say anything about their abilities or capabilities, but they themselves are making a choice to estrange from the child. We talked some to that there. One of the most common factors associated with this parental induced estrangement is what I said earlier, is there's an outside secondary influence that promotes rationalizations for the parent to back out of the relationship with the child. So some of the things we see is the other parent, if they've remarried or something, is opposed to, is threatened by, or creates conflict around having the child in the home. And eventually an ultimatum is presented. Okay, it's either you or it's me. I mean, it's either the child or it's me. You make a choice. So they're placed in that kind of a situation.
Yeah, like a stepmother or a stepfather who really just doesn't like the kid from the previous marriage, but really
Yeah,
likes the person that they married. And so they treat their stepchild badly, and then the stepchild doesn't want to come over. And so they're like, well, their kid would just be better off not being here. And then if that doesn't work, they get to the point where like, well, you have to choose me and this, assuming, if it's a woman, she's like pregnant or, uh, you know, me and your new step family or this kid you hardly know.
yeah,
Yeah.
yeah. And that's unfortunate. In some ways, like I had said earlier, this kind of estrangement is like you're having an alienating parent involved, and almost you're setting up this triangulation again, uh, with the child being caught in it, but the other parent also being caught in that process. And sometimes it's a jealousy based when they come over with and they have other children, and the children are mean to the child coming over. And so the child doesn't want to come anymore. Or they come over and it's kind of like the Cinderella phenomenon, where, oh yes, you're welcome here, but this room is yours up here in the attic, where the mice are. So that's
Yeah.
pretty.
I think we have some space out in the barn. You can
Yeah.
stay for the weekend. Yeah.
Yeah. And we laugh a little bit about that, Braxton, but
But
honestly,
yeah.
I'm not surprised to see that. It may not be in the barn, but it really is. Well, we'll make room for you, but it isn't going to be very comfortable.
Yeah. It's not going to be inviting. You're not going to want to do this again, you
No.
know?
And if the parents have different rules, wow, that really becomes a problem. So child comes over and the father says, now you need to help with the dishes, but the other children are not involved with it. You know, it just creates an uncomfortable place for the child to feel as though they are welcome.
Yeah.
So, regardless of the impotence, the parent becomes submissive to the will of the other party. Okay, another one we talked about already is this narcissistic egocentricity. I think we need to go into that anymore, other than this person wants things for themselves and the child is just a burden, and therefore they want to get out.
Yeah. I want to go party this weekend. So thanks for watching the kid.
Yeah.
You know,
So,
but,
okay, so those are kind of those things there. So, what do we do for intervention? If you remember, we talked some about parental alienation. The objective, and all I want to do is talk about it, the objective, unless you have questions as to technique, but the objective is the reduction and possible resolution of hostilities between the two parties that have drawn the child into that triangulation. And remembering that triangulation sabotages the other parent's attachment with them. And some of the things that we find is there needs to be a calm and mutual focus on the best interest of the child needs to be established. And that's why I said last time, really you need two therapists involved, one working with one parent, one working with the other parent, and coming up with a way to calmly talk about what is the best interest of the child. I'm not going to tell them what the best interest of their child is. I may do some psychoeducation to help them understand something about child development, but honestly, they need to come together and talk about what they hope for the child. And eventually, depending on the age of the child, it's bringing the child in so the child has a voice in regards to what's in that child's best interest.
and so if you have a parent who's really resistant to that,
Mm-hmm.
how would you help them so that you can foster the communication between both of them and I mean eventually bring the child in so the child has a voice? I
Well,
know
I,
you said Well, I know you said you do some psychoeducation, but are there any other like methods that you would use other than just kind of teaching them a little bit about child development?
Yeah, cause of the hurt and the anger that they feel, and maybe the jealousy because maybe if it's a dad, he's already gone off and remarried, or the mother, she's gone off and remarried, and this person can't find somebody. And so it's really getting with them and that person who's resisting. I know a lot of people will throw threats out. Fine, I'll just go to the court and we'll take your custody away. That is not the way to do it. That's a great way to create more hostility. Remember that the clinician has to have, compassionate empathy. They don't have to agree, but they have to have compassionate empathy. And so in this process, then you get a parent who's really resisting. One of the things I want to do is I want to listen. I want to hear. Tell me, what is it that makes it so difficult for you to choose to talk with your ex about what would be in your child's best interest? Where is that coming from? And I want to listen because hearing what they say says a lot of information, and a lot of times it comes from those primary emotions that are being buried up. And they've got the situation. So as I listen, I can come back with them and I can empathize with them in a cognitive way because I may not have had the experience to say, I will bet that that is really a difficult situation to be in when you see yourself. Notice I'm saying perceived. You see yourself as having been abusively treated by your ex, and you don't want to look at that. When was the last time that this happened to you? How did it happen? So now I'm going to begin to challenge the reality and find out if I really have an abusive situation. So I think listening, helping them understand, knowing that you're there for them, so that if they know that I'm there for them, it really says to them, I'll have a therapist represent the child. So now we've got three involved. So that's kind of something that I do. All mutual focus on child behaviors that lead to triangulation. You want to, it's like triggers for anxiety and panic. What are the triggers that spur triangulation off? What are they, and how do we minimize their presentation and avoid them eventually? And free to and encouraged to foster a relationship with both parents. So the parents are really active. Yes, you're going to have a great time with your dad. You're going to have a great time with your mom. I'll be really excited to hear, the fun things that you did when you come up. Now, I'm not saying I'm going to hear what comes back, so I'm going to quiz them. Oh, did your mom do this? Did your dad do this? Did he strap you in? Did he drink while he was driving? That's not what I'm talking about. I'm talking about, oh, so you had a great time. Isn't that fantastic that you and your mom could do that? You and your dad could do that. I bet you're looking forward to going with them again. So that's
Yeah,
kind of the things that you'd want.
wonderful.
Okay. So how about parental estrangement? When you look at parental estrangement, the primary goal are these things. We're going to assume that we've got the parents out of that resistant fight back and forth, okay? And now we've got a child that we want to work with. Then again, we're going to have a therapist representing the child because not all therapists know play therapy very good. I trained a student who went on to become a nationally known play therapist, and she does a great job. And often I'll call Pam and say, hey, can you take a child in to see? So in this, we want to create a context of understanding between the parents, but the child as well. And what we're going to do are several things. We want to resolve the issues. We want to reconcile. Reconcile doesn't mean we're going to get back together. Reconcile means we can be on the same page. And with the child, same with the child, the older they are, reunification is the last part. Now, there are ways to reunifying with an ex-spouse, and that comes about through my willingness to work with them in a fluid manner on behalf of the child. That's a form of reunification, just like hatred is a form of reunification. Okay, and it's reunifying with the child, so the child has that chance to really bond with them. If the child's a little bit older, they may reconcile, they may not reunify like I would like them to, but it's a process.
Yeah. What are usually some of the biggest kind of obstacles in that reunification process? Is it just resistant parents, or are there sometimes mountains that you can't you can't climb and get over?
The thing that is most process of resolving differences. So I put resolution of disaffecting factors. So that is probably the most difficult, because if we can come to a way where, I can agree to meet with this person in this kind of a context to solve a problem. So in other words, we can identify the problem, but in identifying the problem, it isn't your bad or your bad. It's really, okay, what the problem is us being able to find a suitable time to have the custody transition, take place. Okay, so it's a positive statement. We want to be able to have a transition process that is amenable to both parties. Okay, and it's done in a behavioral way that says, okay, now I have something to measure and look at it. So I can begin resolving that. So I've got what is the problem? Then I can come down to what are the possible solutions. Everybody's adding some things in. World, it's, but either is 1,000 solutions, but there is 4 or 5 solutions. Then you take those and you go through and you look at the pros, you look at the cons, and you come down to where you can get to a mutual agreement. Oh, this looks like the best for both of us. And then you implement it, you see how it works. If it works, fantastic. If not, you come back to the drawing board. But what you've done in the process is you've learned how to solve and resolve a problem. Okay, so then we reconcile. Well, I still really don't like you and you don't like me. Well, okay, what is it about me you don't like? Are there some things that we can do that we can reconcile so we are amicable in our interaction?
Yeah, you don't have to like each other, but I mean, you do need to exchange the kids without, fighting each other physically.
Yes.
Yeah. And not screaming and yelling and throwing things.
That's correct. Okay. Yeah. And then the reunification. And that depends on it. And so honestly, if I look at it, the hardest is to get them to understand and open up a way to discuss, to resolve it. And then because once they're willing to discuss things without causing problems, and they're willing to look at solutions, reconciliation is really pretty easy. And reunification is a choice as to how much that's going to be.
Yeah. I mean, once you're able to sit down and actually talk about your problems, I can see that actually reunifying isn't that hard of a process once you actually know why you can't talk to each other, and you understand the hurdles that you had and you've gotten over them.
So that's how that goes. Let's look at this one in terms of alienation-induced estrangement. And this is really simplified and we talked some to it. You have to understand the basis of the resistance when we talk to that. I've got to sit down. I've got to be willing to listen. There has to be that empathic compassion with neutrality. As I listen, if I become judgmental, I lose my sense of genuineness and my integrity goes out the window. So the way I can deal with that is they share their story and I reflect it back. So this is what I'm hearing you say. Because I can reflect it back does not mean I agree. It merely means I've heard you accurately.
I think that's an important distinction for a lot of people, because
Yes.
I can think of a scenario where, two parents walk in and one person explains all of these problems that they have, and then you repeat them back and they go, see, he agrees with me.
Yes.
No, actually, no, I don't.
No.
So,
understanding has nothing to do with agreement. It merely means I hear you accurately. Okay, and in this, two therapists are required, as I talked about. If one therapist tries to do this, they will be overcome. It's just, in my mind, it's very, very difficult, if not impossible, to not have a couple of therapists involved. I mean, if I'm sitting with two people and I'm listening to this person and listening to this person, how does this person really know that even though I feed it back to them, I'm not agreeing with this person, especially when I feed theirs back?
yeah.
And so it just makes sense to divide out the process.
Yeah.
Okay, so child-induced focus of therapy begins with understanding the position of the child and how the relationship was created. Again, much of it depends on their age. I don't see children under the tween years typically estranging from the parent unless the other parent has engaged the alienation process. But once they hit the tween years or the early teens, they kind of have a mind of their own, although they're not cognitively using formal operations effectively because it's not all there. We begin to see them involved in this. So listening to their story is important.
Yeah.
The child's confidentiality needs to be protected. That's why the child has their own therapist to tell the story to, and that therapist is working with them to be able to tell their story to the parent that they're estranged from, and while the other therapist helping that parent to be able to listen without butting in. The butt-ins are a problem. You got to listen. Just shut up and listen.
Yeah.
Okay. So allowing a parent into therapy with the child creates a fear, an atmosphere. And so you got to be very guarded with that child until we're ready to bring the child in. You use discussion, discovery in techniques unique to the child, some experiential kinds of things. Sometimes you'll go for a walk with the child to talk with them. The staleness of an office may not be the place for the child. And of course, you can use reconciliation. You teach them about problem solving. You teach them about reconciliation. You teach them about what reunification is. In other words, they are prepared before the fact.
Okay.
You don't try to prepare them during the fact.
Yeah, especially if they're in like a triangulation situation that has gotten really hard on them. I can see that it would be really important to kind of prep the child and say, look, this is kind of where we're going. This is the ultimate goal. And to also kind of let them know that, like, hey, I'm on your side for this as much as like I'm your therapist to help you with this.
That's right.
It's important that you can like talk to me.
Yes.
You know,
but again, there has to be that neutrality,
yeah,
understand, because the child's story. I know a fellow because I've done some expert work with sex offending, and a fellow who went to prison because the daughter made the allegation and would not, she didn't know her dad would go to prison.
mm.
And so she went and made this up. And when he was sent to prison, then she came forward and said, I made this all up. Well, do you know how hard it is to get out of prison if you're already down there? It isn't like a judge says, oh, okay, bring him home. It's not
How
like that.
did he ever get out?
Yeah, about a year later,
Jeez.
which
Yeah.
was really unfortunate.
Yeah, that is unfortunate, especially under a
Yeah.
false allegation.
Yeah, for him and for his daughter. So,
Yeah.
okay. So, with parental induced estrangement, we've talked a lot about this. So, we're talking about the use of cognitive distortions, assumptions, generalizations, especially rationalizations, justifications. These distortions need to be dealt with, and cognitive behavioral therapy is a good way to deal with some of them. And so you're working through that. You're working with two therapists. And basically, we're working on resolution and reconciliation, and then reunification. And since we've talked about it, I don't want to go a great deal more into it unless you have questions.
The reunification, well, what would the kind of steps look like? I know that you have it down as a stepwise manner. Is there a kind of normal course that it would take, or is each kind of reunification process so different that they don't really correlate?
Well, it's titrating medication is.
Yeah,
So
that
if you have to get up on this high dose of medication, we titrate you by giving you a small amount, making sure you adjust to it, then a little bit more, you adjust to it until we get you up to the level that's there. Well, much the same way is you're titrating their connection by bringing them together first in short visits. I like planned visits. So, and I like planned visits where, in a context of therapy, the child and the therapist and the father and the therapist talk together about what would our first time together be like? What would you like to do? So again, that child has a voice in, if they're old enough, a voice in something with the father. Eventually, I might get to a point and say, okay, so now let's take 1 week and your father decides something he would like to do that he'd like to do with you. So that brings the child into the father's life. And then the next week, you choose something you'd like to do, you'd like your father to do with you. And gradually you increase the time and the frequency. And that's pretty common to most, that's how I would engage it.
okay. Before.
And the role of the custody evaluator. Well, honestly, Braxton, if there were true estrangement, custody evaluator could just go in and say, well, the father's not involved, mother's really not involved. Let's give full custody to this parent. I think that's a mistake. I really think, first of all, if there is estrangement, they're not ready for a custody evaluation.
Yeah.
I think the outcome will bias the attachment process of the child and the opportunity to attach to the other parent. So what would seem to be appropriate would be for the non-estranging parent, once the estrangement is recognized, to seek out help from an informed therapist to bring those two together.
Yeah. Does it seem like the custody evaluators tend to just pull the trigger very often? The kind of situation that you described earlier, especially in a situation where like the father or the mother never had a chance to bond with the child because of the other parent.
Mm-hmm.
Do custody evaluators sometimes make a habit of coming in, kind of taking a look around and going, well, I guess this is how it is, without kind of digging deeper?
Well, I'm hoping that evaluators are astute enough that if they are asked to do an evaluation, that before they really get overly involved and invested in it, they have some idea as to what the dynamics of that system is. And when we talk about custody evaluation, I'll talk a little bit more about that. Because if they just go in and you have an alienating parent, that alienating parent is going to want to suck that evaluator into their system. And it doesn't matter the allegations they will make. They will make allegations that are out of this world.
Yeah, they'll do whatever they can to support the alienation that they're doing.
They certainly, if that goes to court and the alienating parent's position is sustained, this other parent almost never has a chance of restoring their relationship to the child. I know another situation right now where that's the case. Person's been paying child support. Kids won't come and see him, but he still pays the child support. Took it to court. The judges didn't talk with the kids. The kids are older. They're teens, some older, latter teens. And just made a decision, no, you're going to go on just the way it is. And too bad. And they had a PI who found that someone had moved in and had been there with him. The drugs were being provided to the kids, and still the court did nothing about it.
Terrible.
It's a tragedy,
Yeah.
And so here's this parent paying thousands of dollars for child support, which leaves him very little for his own living expense, and has no relationship with the kids.
That's terrible.
So
like you said, it really is a tragedy.
it is a tragedy. So I'm hoping that evaluators will look at this, and if they get any inclination that there's alienation, or that they need to draw in somebody whose specialty is looking at alienation and estrangement, how do I ferret that out?
Yeah, I think that would actually help a custody evaluator a lot, especially if they don't have any kind of specialty in that area.
Yeah. Well, even if they do, again, their role is to evaluate the system. But if they get involved in any type of therapeutic way, they have biased the evaluation. If I were to review an evaluation and find that the clinician who had done the evaluation have done any therapeutic intervention, I would not be a happy camper with that evaluation.
Would that be enough to get like the custody evaluator, the evaluation thrown out? If
Well,
they
I don't,
weren't,
I mean, that lays in the judge's hands whether it gets thrown out or not. But
yeah,
to me, it makes it, and gives a biased tone to it because it's so easy. An estranging parent, we look at and say she or he's very hostile. But to an evaluator, they can be as smooth as icing on a cake and as seductive as that icing.
yeah, yeah. Especially if you get sucked in,
Yes,
I can see that it would be really hard to maintain your unbiased nature.
yes, yeah. So my suggestion is if get get the right thing, go back to the attorneys or whoever has asked it and say, hey, this is how I think would be best to approach this before we try an evaluation. Now, it may mean that I put a guardian ad litem with the child, you know,
Yeah,
uh, so the interest of the child is sustained and visitations can take place and things like that. But um, the evaluator needs to just step back for a little bit.
yeah.
So, questions?
Hmm. I think that one of the questions that I have, if you have somebody who is being so covertly manipulative, they're still doing everything that they're doing on purpose, but they're finding ways to trick the custody evaluator to kind of pull them into their web of lies. Um, is there any way that you can address this or kind of ferret it out during the therapy process?
Well, if you start seeing that, Braxton, really, in my opinion, what you're working with is most likely a personality disorder. And if it's a personality disorder, that's going to take some pretty heavy work. So, I mean, it might be that this person, it might be that the court might say to this person, you need therapy and work this out before we let you back into the family system. I don't know. It's a real hard question. Uh,
Yeah.
Fortunately, there are not that many, but there are enough of them.
All right. I think that was my last question.
Well, thank you for the time, and I hope this is instructive to those who listen to it.
Absolutely. I think this will help a lot of people understand kind of the situations that they find themselves in and how to proceed forward.